Welcome to Wanja's Health Diary, where today we explore how maggots are being used to treat wounds. We have Christopher Kibiwott from Kenyatta National Hospital who will take us through how these microsurgeons are performing wonders. Karibu sana.
Thank you.
Tell us about these assistants that you have in the name of the maggots. What do they do?
So maggots, in what we call maggot debridement therapy, what they actually do is to remove the dead tissue, what people call the rotting flesh inside the wound. When they remove the dead tissue, that is how the wound now is able to granulate well and heal, or it is prepared for the next process, which might be skin grafting.
How do you determine that a particular wound is stubborn and slow healing, and then you decide to introduce the medical maggots?
Actually, we determine when we see that there is no progression of the healing tissue, and there is usually evidence of a lot of dead tissue, what we call necrotic tissue. That is how we determine that this wound now needs maggot debridement therapy. And let me say that it is actually one of the three ways of removing dead tissues. We have the surgical, which entails a patient going to theater, put under anesthesia, and then the dead tissue is removed. That is one method. The second is what we call chemical debridement, where we use a chemical which debrides, removes that dead tissue slowly over a period of time, maybe up to 4 weeks. So both, as compared to the both methods, maggot debridement therapy remains the cheapest and the easiest to use. And one good advantage with maggot therapy is that even if the patient's blood level is low, we can still use the maggot therapy. Even if the patient cannot go to theater for any reason, we can still use the maggots to do the debridement. So I am saying this is not the only method of doing debridement. They are one of the ways, and we always strive to improve ways of removing the dead tissue from the wound.
And in terms of the process of getting these maggots from where they're grown in the lab until the application process, please take us through the preparation of the wound and then the application, and what are some of the ways that you prepare the patient and family during the application of the maggots?
Okay, we start with identifying the wound, usually through the clinicians. A doctor might notice that the wound is not healing well, or even the wound care experts might also notice the same. So when they realize that, we go and talk to the patient that we need to apply maggots on their wound, because these are biological things, and the patient will actually experience what might be going through our body. So usually we have to explain to the patient what it entails. We are going to put the maggots for this number of days, then we remove after this number of days, and from there you might go home or the next level is taken. So once we have counseled the patient and they accept, some of them might even involve the relatives who might also say it is okay. Once it is okayed, we usually estimate the measurement of the wound. When we know the size, we now call Calro, who are the people who have the lab which prepares the maggots. We inform them about the size. We usually say up to 4 maggots per centimeter squared. So once we tell them the maggot is this kind of size, they prepare. And we have to do this at least 24 hours prior to the application. So once that has been done and the call has been made, we wait for the Calro people to come the following day with the maggots. Then what do? We apply. It is just the normal way we do the cleaning of the wound. After cleaning, we put the maggots. We put a slight gauze on top. Then we close it. And then, because we had already explained to the patient what to expect within the next 48 hours.
What can a patient expect during that time? Is there anything that they should look out for?
Okay, we usually tell the patients what they should look for. The second day after application, there will be excessive exudate, because the maggots usually use the enzymes. They secrete some enzyme which is used to digest the dead tissue. So we tell them to expect that excessive exudate. Another thing, maybe after 24 hours, they might experience some slight movement of the maggots. As soon as they are fed, they have grown, they might start moving around, and actually it's not painful. So that might be expected in some patients. and then within 48 hours we are there to remove them.
In terms of affordability, given that the cost of healthcare and especially in managing chronic diseases is really quite high and sometimes out of reach, what is the cost of the entire treatment?
So the cost could be as much as 50,000 if you use the conventional method. But with maggot debridement therapy, as I said before, sometimes we just use one application which is costing 4,000. Or we may repeat, if the dead tissue is massive, that is about 8,000.
All right. And what about once you have applied the maggots and they have stayed for 48 hours? What next in terms of what's the procedure when you come to remove the maggots?
After 48 hours, usually the maggots are ready to go to the next stage, which is the pupa stage. Once we remove them, we don't want to increase the number of insects in the environment. We do what we call euthanize. We just suffocate them and throw them like any other clinical waste.
What is your hope in terms of the acceptability and the use of maggot therapy in the treatment of wounds in Kenya?
The acceptability will always be there so long as we explain the procedure to the patient. And the place of maggot debridement therapy as we go forward in management of wounds in Kenya, the demand is going to be high so long as the people actually know about it. And we are trying to make sure that the information reaches every part of the country, because we don't want to see people going through amputation because of a stubborn wound.